Anyway, let's engage more on this particular issue. A member on the Health Committee of Parliament, Dr. Kingsley Agyemang, is joining us for us to know the side of the parliamentarians when it comes to the Health Committee. Good morning, Honorable.
Good morning, Philip.
I trust you are doing well.
I'm well.
So, in the Ashanti region, a press conference was held yesterday. 11-month salary that has not been paid to over 6,000 nurses. I want to find out from you if this has come to the attention of the Health Committee, and if yes, what is going to be the line of action that the Health Committee will be taking, at least to ensure that these nurses are sort of paid.
Well, thank you very much, and a very good morning to your cherished viewers and listeners. We always say that people drive value, and when it comes to healthcare, the healthcare worker provides a very essential service to the healthcare delivery. It's rather unfortunate that our 6,500 or so of our health workers who have been working the whole of this year, who were captured in the budget, have still not been paid. Very, very, very unfortunate, and I sincerely sympathize and empathize with them that high. We can't continue like this as a nation. How do you feel as an individual when you have worked for 11 months and there's nothing to show? You're not being compensated. Everybody has a right to work by virtue of the UN Convention to work. Yeah, you've engaged them. It's not like it's not a situation where you are saying that you don't even appreciate their work. They go to work every day. Yet 11 months of a reset agenda, they will not be paid. When we say the government is not spending, people think they're playing politics with it. But look at the health budget for 2025. When we're considering the estimate, releases that have come to the health, Ministry of Health, and for that matter, 8 agencies, when it comes to all the 3 lines of budget, was just about 64% of releases. So it explains that the government is not spending. If you are not spending and you are playing politics with the economy, it's very, very unfortunate. These are workers that families are dependent on. They've rendered their services to the country and you have not paid them. Very, very unfortunate if you ask me.
But you have also been raising questions about the government not prioritizing the health sector. Do you still stand by that?
Of course. If it was a priority, you are going to buy presidential jets. You are going to do express road, new road altogether from Accra to Kumasi, where there's a road that is being improved, and the health worker has not been paid, and they are not motivated enough because they are not receiving their basic requirements or what you do them. And you expect the health worker to deliver to even excel. It becomes very difficult. It becomes very, very, very difficult. If I tell you the number of engagement these workers have to go through before protesting, it is not a joke. It is more or less like we don't need you. You can do your work. We can't be bothered. This does not appreciate the Ghanaian worker, especially essential service like healthcare. You may think that these are people offering health services at a very basic unit. First port of call, 6,000 or so of them are circumstance now. Very, very, very unfortunate. We have to begin to realign our priorities as a nation. Because I always say that you can't play politics with the health of the nation. Because our wealth is the source of our health. You can come up with a lot of policies if you don't have very healthy population, or if access to health care becomes a barrier as a result of workforce. It becomes very unfortunate. So, Philip, we are just adding government. That health service delivery is not something we can continue to do. We can continue to perform the way we are performing about it now. No.
But as a member on the committee, we know that the health minister now, Minta Akando, was on that same committee, and he was very vocal when it comes to issues like these? Will you be raising it on the floor of Parliament, or will you actually be asking the committee to sort of pose some questions to him and find answers to this so that the nurses could be paid?
I mean, one good thing about the work of Parliament is that, we represent the people. And these 55,000 or so are coming from various constituencies.
That's 6,000, over 6,500.
6,500 are coming from various constituencies. So every member of Parliament is our collective responsibility to ensure that we say to government what we need to say to him, so that these workers can be paid, because it has a cascading effect. Because they have dependents, they have necessities to take care of. If you are not paying them, are you saying you are terminating the appointment? Their services are still needed in the healthcare the service delivery. So we are urging government and pleading. We've gotten to a point where we have to plead that we are pleading on behalf of these Ghanaians who are engaged to serve in our healthcare architecture, that they have the right to be paid, and government must respond accordingly. It's very, very unfortunate. Especially, next week we are celebrating the Unitide. How are they supposed to spend?
Well, they said they are not thinking about Christmas.
Of course, if you don't have a peace of mind, if you are not going to be paid, how can you think of Christmas? You can't think of Christmas. Very, 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 very unfortunate. And it is not them alone. It is the numerous dependents who are also looking up to them in one way or the other. Very, very, very unfortunate, if you ask me.
Thank you so much, Honorable. We are grateful for your time.
You.
Dr. Kingsley Agyemang is member on Parliament Health Committee and also the member of Parliament for Ebuakwa South, and he has said it clearly what really he thinks that the government should do. But he's also mentioned that some sort of questions we put, though every member of Parliament in the House can also go ahead and do that. I remember very well the health minister now, Dr. That is Minta Kando, Kwabena Minta Kando. He is very vocal when it comes to these things. I know he went to Kolebu to actually question why the lift there wasn't working, and when he got there,
we all saw that.
Yes, there was sort of
banter,
a pushback that you didn't tell us that you were coming here just to come and check elevator or to check whether the lift is working or not. So I know what Kwabena Minta Akando can do, and I know what is being done in the health sector. But now that you are at the helm of affairs, maybe you would want to see what you were doing then when you were the ranking on the health committee, and what you can do now when you are now the Minister of Health, because there are a number of things that must be done in the health space, and the biggest and the most important resource you can ever think about in an organization is the human resource. You can't take it away. You can bring the money, you can bring the cars, but it's a human being that must man all these things.